At the onset, I want to thank my respected elder brother, Dr. Rutul Goapalani, for this wonderful initiative under the banner of D-Genius, and always grateful to Dr. Bongshi Shabu sir and Dr. Rakesh Parikh sir for their enthusiasm and their initiative like D Insight. And may I also thank my moderator, Dr. Aniket Inamdar, for moderating this interesting session. Let's start today's discussion on review of literature, how to systemically we should conduct literature review. Today we'll discuss. So let's start with this story. And I think this story is very interesting, and hope my screen is visible. Yeah. So an early clinical trial. In the late 18th century, King Gustav III of Sweden decided that coffee was poison and ordered a clinical trial. So the king condemned a convicted murderer to drink coffee every day. In the control arm, they had taken another murderer who was condemned to drink tea daily. So outcome was very hard outcome, that is death. Now, king had employed 2 physicians to determine the outcome. Now what happened? The results, the 2 doctors died fast. The king was murdered. Both convicts enjoyed long life until the tea drinker died at age 83. But no age was given for the coffee drinker. So what is important? One should not rely on such a small sample size. Perhaps the end point was too harsh. The outcome of the trial had no effect on the decision makers. Coffee was forbidden in Sweden in 1794 and again in 1822. So what are the conclusion from this particular study? And I must acknowledge Professor Nitya Gokte for this particular case study. So p-value was more than 0.05, so conclusion not possible. External events and other biases may have confounded the result. Most importantly, kings should not mess with clinical trials. And at least this should be our take-home message, that authors should have mercy on editors and editorial staffs, because that particular clinical trial was again given to certain journal for publication. So let's start today's journey with review of literature. Why we should perform literature review? It saves ourselves from work. Literature review prevents duplication of effort by summarizing existing research and revealing what has already been done. We can understand the subject matter better, the key theories, methodologies, and the current findings which are available in the field. This also suggests new research topics, questions, and methods, identifies gaps in the literature, fostering innovation and new directions for our research. When you talk about literature review, it is not just a summary. Why I am telling this? Because many times when we evaluate thesis, the literature review, we found it is a summary of what multiple already done conducted research or multiple other review of articles. Literature review is about information seeking. It efficiently scans the literature using manual or computerized methods, identify potentially useful articles and books that align with research objectives. It helps us in critical appraisal, applying the principles of analysis to evaluate the validity and reliability of studies. Focus on identifying unbiased and credible sources to support the research. So, literature review is nothing but an organized search. Step 1, organize information. Relate the collected data and findings to the research question. Using systematic approaches such as categorization or mapping. Step 2 is about synthesizing results. Summarize what is known and unknown in the research field, highlighting those connections and trends which is present among the reviewed studies. Step 3 is about identifying the lacuna, defining gaps in knowledge as they appear in the literature. Also, that will highlight areas where further research is needed. Finally, the step 4, which develop questions for further research. This is about information retrieval, identifying within a large document collection a subset of documents whose content is most relevant to the user's needs. The database organization, or we can say database management, that means structuring and managing databases for efficient access to relevant information, highlight the importance of proper categorization and indexing. Also, the structure of the query, it should be user-defined, creating well-defined queries tailored to specific research requirements, emphasizing the role of keywords and Boolean logic. So when we talk about database structure and management, I think we need to know about the database management appropriate, organizing and structuring databases to ensure efficient data storage and retrieval. It helps us, or it facilitates quick access to relevant research documents and improves search accuracy. When we talk about indexing, that covers all the terms in the database for comprehensive coverage. It highlights common and frequently used terms to improve the search relevance, and it uses terms as delimiters to streamline queries and data retrieval. So what are the appropriate places to search? We need to understand this general information, the HORN certified sites, the Health of Net certified sites. For an example, it could be WebMed, it could be specific Google apps, but generally when we talk about Google, they covers all the web search engines. So they are general web search engines, but HORN certified sites are generally the Health of Net certified sites. The very common is the Medscape or WebMed, as we have discussed. When we have certain specific query, we need to use the databases such as PubMed, Scopus, and Google Scholar. And we need to use the advanced search tools for tailored results. So there are certain archived full text articles where we get free open access resources, or sometimes subscription-based articles from libraries. And when we talk about systematic reviews and meta-analysis, which are evidence-based medicine sources, the Cochrane library is mostly helpful for these comprehensive reviews. Let's discuss about a little bit on PubMed. So this is PubMed. We need to understand this Boolean query because we need to search this database by this Boolean query. For an example, if we use AND, that means if my query is diabetes and chronic kidney disease, it retrieves documents that discuss both diabetes and chronic kidney disease. Now, if we talk about OR, so diabetes or chronic disease means that will retrieve all documents discussing either diabetes or chronic disease or both. When we talk about not, that means diabetes, not chronic disease, that will retrieve documents that discuss diabetes but exclude those discussing chronic kidney disease. So as we were mentioning, you can see here the diabetes, and if we talk only search diabetes, you will get around 1,02,161 articles results. Or if we just type chronic kidney disease in PubMed and search, we'll get around 2,19,000 results. Now, diabetes, not chronic kidney disease, then we'll get those results who are taking only diabetes, excluding those which includes chronic kidney disease. So it was around 10,21,000. Now it becomes 9,78,000 because they will exclude those chronic kidney disease related articles. Okay, so that is the not thing. Now, if we talk about diabetes and chronic kidney disease, so the results will be less because these are the 42,880. Only diabetes, it was 10,21,000. The only kidney disease, it was 2,19,000. But when we talk about diabetes and chronic disease, so this paper, all these papers consist both the keywords diabetes and chronic kidney disease. So the result is 42,880. Now, if we make it little bit more spacious, more other terms, for an example, diabetes or hyperglycemia, so that will capture other articles we miss due to only using the term diabetes. So diabetes or hyperglycemia and chronic kidney disease or chronic renal failure, then we can get some more results. You can see it was 42,880. Now it will become 46,393 results. So by this way, we need to use the Boolean query. So selecting studies for literature review. The first step is read and critique the studies. Carefully evaluate the studies to assess their relevance to research question. We need to check for validity, reliability, and bias. Then we need to compare the methods, results, and findings. Identify similarities and differences between methodologies and conclusion of different studies. Look for patterns or contraindications. Next step 3 is select studies of good quality. We need to choose studies with strong methodologies and significant findings. Focus on peer-reviewed and credible sources. Then finally, the step 4 should be tabulating the information and compare. So we need to create a table summarizing the aspects, most important aspects of each study. For an example, objective of the study, methods of the study, results, because this will help in organizing and synthesizing the information. This is an example table, and most importantly, we need to make them arranged in a chronologically order. So from 23 to 2020, we are going. So for this, the first is citation, then the design of the study, then objective, the study population, sample size, measurable outcomes and results, and finally the author's conclusion. It is not your conclusion, it is the author's conclusion, so that we can make this table properly. Now, many times we need to write a literature review, especially this is very important who are preparing their thesis. The first paragraph is the introduction paragraph. There we clearly mention purpose of the review, organization and structure of the review, basis of ordering, most important to least important or earliest to most recent. The second paragraph, generally it is an empirical literature, includes quality studies relevant to the topic, summarize each study with paraphrasing, and obviously we need to avoid the direct quotes and we need to properly reference, provide a scholarly yet brief critique of each study's strengths and weakness that is relevant to my primary research. The third paragraph, which is the summary paragraph, that concisely present what is known and not known about the topic. It highlights gaps in literature and areas for further research. So when we talk about literature review, surveys all relevant literature to determine what is known and not known about a particular topic. Why? Again, it is important. Growing demand for literature reviews due to increasing volume of scientific publications. And it can help us in synthesizing insights from recent literature, identifying research gaps, providing foundational understanding for a new research. The challenges are it requires a wide range of skills like critical thinking, synthesis, and citation. So to define the topic and searching, we need to define a topic and audience first. We need to choose an engaging, relevant, and specific topic. Identifying the primary audience. Who will be my audience? Is it a diabetologist? Is it nephrologist? So we need to prepare that accordingly. Search and research. Use diverse databases. We can use Web of Science, Scopus, not only let's restrict ourselves in PubMed. The Scopus is also a very good database. So keep a detailed record of search terms and excluded materials because these are important while we are preparing a systematic review. Seek previous reviews to identify existing knowledge gaps. Take notes while reading. This is a very important practice because writing notes during reading is actually capturing thoughts and ideas which we can use later. What type of review we are choosing? Mini versus full reviews, narrative versus systematic reviews, and also consider journal requirements and time constraints. Finally, we need to find a logical structure using certain diagrams, mind mapping to organize the review. We need to include an introduction, well-structured body, and clear conclusion. So be critical and consistent. Critically evaluate the methodologies, identify gaps, and highlight major achievements, and then include your own relevant research. Be objective when incorporating your own work, not only just to increase the citation of your own work, you will cite your research. So that is very important. The relevance you need to find out. Stay up to date. Regularly update the review with newly published materials to remain relevant. Ethical practices like avoiding bias, accurately document the source to avoid any type of plagiarism. As today we are talking about this tagline as being asked by Dr. Rutul, from confusion to clarity, the need for systematic review. The problem is we researchers today face an overwhelming volume of literature. Without a clear approach, literature reviews often become disorganized, biased, repetitive. So transition from confused, scattered browsing to a structured, transparent, and reproducible synthesis of scientific evidence is extremely important. And that is the goal of systematic review. So it is a structured, protocol-driven process for identifying, selecting, evaluating, and synthesizing research evidence to answer a specific question. When we talk about narrative review versus systematic review, narrative review are generally descriptive and subjective, whereas systematic review, they are objective, follow a predefined protocol. When we talk about narrative review, they often lack reproducibility. They are just narration and they based on selected sources. But when we talk about systematic review, they are transparent. They should have rather replicable methodology, and they are comprehensive, covers all eligible studies. The first step is to define the research question and protocol, establishing that the foundation of high quality systematic review is a clearly defined, focused research question with a predefined protocol, because we want to ensure rigor, transparency, and consistency. We need to use a structured framework for question formulation. And that is why I think the PICO, which is important for clinical or quantitative research, P for patient or problem, I for intervention, C for comparison, and O for outcome. And for qualitative research or mixed method research, the SPIDER acronym is important. S for sample, PI means phenomenon of interest, D for design, E for evaluation, and R for research type. So we need to use this structured framework for question formulation. So very common example for PICO, if the question is, does intermittent fasting improve insulin sensitivity in adults with type 2 diabetes? Here the P is adult with type 2 diabetes, I is intermittent fasting, C is normal diet, and O is improved insulin sensitivity, the outcome. So when we talk about scope, again, for systematic review, this scope is, we need to predefine the scope, the inclusion and exclusion criteria. The language, we need to confine to the English literature, time period, last 10 years, for an example. Population time, adults, not children. Study design, we will take only our cities. So like this, we need to predefine the scope. And the protocol should be registered. Generally, we registered it, the platform like Prospero. The document like search strategy, eligibility criteria, outcome interest, planned analysis. We should provide these documents appropriately. Why this step matters? Because it prevents selective outcome reporting, ensures reproducibility, enhances credibility and acceptance of result. And most importantly, it guards against moving the goalpost during the data synthesis. Now, if we want to discuss this case scenario, poor versus good question framing. This is a very common researcher's dilemma. Dr. A wants to explore whether diet helps diabetes. Now, this question, if used, diet helps diabetes, it is a very vague, unstructured, and this leads to hundreds of unrelated studies if we go for searching this. So what could be an improved version using PICO? In adults with type 2 diabetes, that is the population part, the intervention part is, does a low carbohydrate diet, the comparison part, compared to standard low fat diet, outcome part, improve HbA1c levels over 12 months, the time part. Sometimes we use T after PICO. then it complete. So in adults with type 2 diabetes, does a low carbohydrate diet compared to standard low fat diet improve HbA1c levels over 12 months? This is a focused search, fewer irrelevant hits, and cleaner synthesis. Step 2, the systematic literature search strategy. How to design, execute, and document a comprehensive, reproducible literature search. This is the backbone of systematic review. Number 1, we need to select relevant databases. We had talked about PubMed, we had talked about Scopus, Web Science. For systematic reviews, clinical trials, the Cochrane Lab library is there, and embassies also, which help us to know about drugs, pharmacology, clinical research, and mostly Europe focused. And how to use Boolean operators. This is very important when we talk about diabetes and fasting. So that will include both the studies, which those studies only which consist these two keyword, both diabetes and fasting. So we narrow the search. When we talk about or, it broadens the search with synonyms. Generally, for synonyms, we use the terminology or, intermittent fasting, or time-restricted eating. Like that one. When we talk about not, so we are excluding certain things. So for here, diabetes, not type 1. So we are excluding type 1 diabetes related. So for an example, in this particular study, intermittent fasting or time-restricted eating. So we try to capture a little bit larger volume of study which contain both the either the intermittent fasting or time-restricted eating. On top of, and as we are using, and type 2 diabetes. So as we are talking about type 2 diabetes, so that will include those studies which contains either intermittent fasting or time-restricted eating in type 2 diabetes. And now we are also checking insulin resistance, the change in the insulin resistance. So we are talking about and insulin resistance. So in this way, we can use the precise search strategy. And most importantly, depending on the study need, we need to specify the year range, the language, the human studies only, if it is relevant. And third step is document and save your search strategy. This is very important. The syntax, we need to save the search queries and syntax. The record should have the database name, search date, filters applied, version of results. These all are important when we are conducting systematic review, meta-analysis. And use generally a search log table to maintain the transparency and allow reproducibility. What are the tools for managing search results? These are very important. You need to use it. Just like Facebook, when we were nice to Facebook, we were very afraid of using Facebook. But while using, you are now master of Facebook. Similarly, if we use by our own these softwares like EndNote or Zotero, we will be familiar to that. And I may request Dr. Rutul, if we can address this type of software hands-on training, so that also could be very much useful for all of us, how to use RAN software, how to do the screening and collaboration platforms. So they are collaboration platforms. There are how to use the Excel sheets or Google Sheets, the manual documentation and tracking. The step 3, the study screening and selection. So it demonstrates a systematic, transparent, and reproducible approach for selecting studies that meet the predefined criteria. This is a very much important step to ensure quality and consistency in our systematic review. So the phase 1 of initial screening process is title and abstract screening, and phase 2 is the full text review. So first step, we need to check the title and abstract. We need to go through them along with our inclusion and exclusion criteria, and need to rapidly eliminate irrelevant articles. Full text reviews, which retrieve full text of shortlisted studies. We need to apply detailed criteria to confirm eligibility. Must report HB1C level, must be RCTs. For an example, we need to apply this. And this is a very important tip for all of us, that pilot screening with a small batch to calibrate our reviewers. That is extremely important and very helpful for us. So we can do that before starting the original screening process. Now the PRISMA flow diagram, which is a must. So using this PRISMA flow chart is very important because we want to show the study selection journey. First, identification, total records found in all databases, then screening, records after duplicates removed and abstracts reviewed. Then the eligibility criteria, the full text articles assessed, then the inclusion, the final studies included in the synthesis. So this could be an example, the identified 2000, then after duplicates, it becomes 14,000, then screened 1,400, full text reviewed 150, then we include 35. So this dual reviewers is important for objectivity because two reviewers independently screen all studies, and there could be certain disagreements, but that could be resolved through discussion, and sometimes we may need third-party adjudicator. Why this matters? Because it reduces selection bias, increases reliability, ensure fairness and accuracy. We need to be very transparent in record keeping. Just like our original research, this record keeping is very important, maintaining logs for every decision made. Reason for why I am excluding: due to wrong population, due to not peer-reviewed manuscript, due to incomplete data. And in this, we need to use Raven, an AI-assisted screening platform. The Covidence streamlines inclusion or exclusion, supports PRISMA tracking, Excel for custom logs and checklist. This is an example. Think of the PRISMA diagram as your audit trail. If someone wanted to replicate your review tomorrow, could they follow the same path and reach the same set of studies? That should be our objective, so that they also can reach the same set of studies. Step 4 is the data extraction and quality assessment. How to systematically extract relevant data from selected studies and evaluate their quality and risk of bias, ensuring that the evidence used is both accurate and trustworthy. So this is an example, a common fields to include. For an example, this is, we can say, creating a structured data extraction template where these fields like author and year, study design, sample size and population, intervention, comparison group, outcome measured, duration of studies, main results, effect size, and limitations we are mentioned with the description. So citation information, what type of study? Is it RCT? What study? Case control? What type of sample size? What is the demographic? What is the setting? What is the inclusion exclusion criteria for that particular study? What are the intervention, treatment or exposure being studied? Comparison, whether it is placebo controlled or standard of care or certain other intervention. What are the outcome measured? Here we are talking about HbA1c or weight loss or insulin sensitivity. Duration of the study, time frame of the observation. Then the main results and effect size. Here we need to mention, we need to categorically point out the effect estimates, p-values, along with confidence interval. Many times we stop writing the p-values, not giving importance on confidence interval. That is wrong. Many good journal will not accept our paper. They will reject. So also in the limitation field, we need to mention the confounding factors or biased mention. So these are the few important tools. And now we have the covidence or Revman, which generally helps to create this structured data extraction template. The next, we need to do the quality assessment, the risk of bias evaluation. Not all studies are created equal. So assessing quality helps filter out the flawed evidence. And we have different tools for different study types. For randomized control trials, we have the Cochrane risk of bias tool, the ROB2, which assess in mainly in 5 headings: randomization process, allocation concealment, yes or no, the blinding, the missing outcome data, the selective reporting part. And when we talk about other types of studies like observational study, we can use this Newcastle-Ottawa Scale, or for systematic review, we have another scale that is Amster 2. So with this type of tools, we can have an idea of quality and the risk of bias evaluation. Why this step is crucial? It reduces the influence of low quality evidence. We can clearly mention those studies which have low quality, ensures credibility and objectivity in conclusion. Also, it allows for sensitivity analysis, because many times we will face in systematic review, meta-analysis, a very high degree of heterogeneity. If we do the it allows for sensitivity analysis, we can include high quality studies. The garbage in and garbage out, even a systematic process can fail if poor quality studies are included. So we need to understand which studies we need to garbage out. This is for an example, the studies we are conducting. We can mention in this point the author, population, intervention, comparison, outcome, and effect size. Struct extraction with 2 to 3 studies to pilot your form. Make revisions before committing to the full data set. So this should be our take-home message, because this pilot is very important when we are starting this type of studies. The step 5 is the synthesizing and interpreting the findings. It actually helps us explain us how to meaningfully combine, compare, and interpret findings from multiple studies in order to produce a coherent conclusion that advances understanding in the field. 2 important steps in this synthesize. One is choose a type of synthesis based on data. And then number 2 is the highlight trends and knowledge gaps. So when we talk about choose a type of synthesis based on data, then we need to understand this qualitative synthesis used when studies are heterogeneous. For an example, population-wise, outcome-wise, or design-wise, we need to organize the findings by thematic categories like intervention types or geographical patterns. Then chronological order, how understanding evolved over times. We need to highlight patterns, contraindications, overarching insights. So generally, we need to use the summary tables to map which studies support with themes. And when we talk about quantitative synthesis, the meta-analysis part, this used when the studies are comparable in design, population and outcome measures. So it is not, I have one DAPA-PIO fixed dose combination. Now I want to see its effect on heart failure. Now we got DAPA-PIO 1 RCT, DAPA-PIO 1 observational study, prospective observational study, 1 record-based observational study. We cannot do meta-analysis there. We cannot do quantitative synthesis there. There we need to rely about the descriptive synthesis. So statistically pool data to estimate overall effect size. When we do quantitative synthesis meta-analysis, we get weighted mean difference, odds ratio. So here we need to use the tools like Revman, R package, and the report outputs. We will get the forest plot, effect size with 95% confidence interval, and the heterogeneity statistics, the I-square value. Also, the highlighting the trends and knowledge gaps. What is known, areas of consensus, cross studies, what is contraindicated, inconsistent or conflicted finding, what is missing, under-researched populations, methods or outcomes. And this actually help us in form of conceptual maps, which visualize how findings connect. Summary tables compare key study characteristics and outcomes. So interpretation is not just about summarizing, it's about extracting meaning, resolving contraindications, and showing the way forward. There are certain common pitfalls, and like it it is important to understand because it helps researchers avoid frequent errors encountered during literature review and adopt practical ethical strategies that enhance rigor, reproducibility, and transparency. So what are the common pitfalls to avoid? First of all, the vague or broad research question. Without clear boundaries, your review becomes unfocused and unmanageable, leads to irrelevant studies and difficulty in synthesis. Does diet affect health? If this type of question you feel, rather than we need to be more focused. Does intermittent fasting improve HbA1c in adults with type 2 diabetes? Coming to poor search strategies, inadequate use of databases, missing keywords, or improper Boolean logic fails to capture the full scope of relevant literature. Effect would be we can miss studies, leading to incomplete review and biased conclusion. Ignoring the risk of bias, not necessarily, it is very important. We need to assess the quality of the study. So not assessing the quality or internal validity of included studies, resulting in flawed studies which distort our findings. So we need to use these tools as we had already mentioned. Inconsistent screening and selection, lack of standardized application of inclusion or exclusion criteria, single reviewer bias or arbitrary decisions. We need to use dual screening and log exclusion reasons. Over-reliance on abstracts, relying only on abstracts without reading full text can lead to misinterpretation, and key methodological and outcome details often only appear in full text. So that is why we need to go to the full text. There is no shortcut. We need to read the article. So what are the important tips for high quality review? Keep detailed documentation. Track your search strategy, databases used, filters applied, and reasons for study exclusion. Make your process transparent and reproducible. Maintain version control. Use folders and date-stamped files to organize protocols, extraction sheets, and drafts. It helps when collaborating across teams and revisiting earlier decisions. This is very important. We need to use. Pilot your process. Run test searches. So piloting is always helpful for us. Screening on a small sample. Use this to refine the inclusion criteria, search terms, and extraction templates. And update the searches before submission. Literature is dynamic. We need to understand. Rerun searches before final submission to include the most recent studies. Otherwise, the reviewers will send you a notice. You had missed this study, so we are rejecting your systematic review meta-analysis. All your pain will go in vain. So especially it is important for reviews that takes months to complete. What are the important ethical considerations we need to remember? The plagiarism, always paraphrase, and citation is important. Referencing is important. I think there should be one specific session on referencing. We need to avoid this selective report. So avoid cherry picking only positive findings. This is very important. We need to also understand the importance of negative findings, that data manipulation. Report all outcomes, even non-significant one, faithfully. Be transparent. Transparency is the key. Declare the funding sources and conflict of interest, if any. So final takeaways from chaos to clarity. And again, going back to chaos, I think this topic is very vast. So the 5-step framework recap, we need to again recap what we had learned today. Ask structured question using frameworks like PICO or Spider to ensure clarity and focus. Build a systematic search. Design a repeatable, transparent strategy using Boolean logic, multiple databases and documentation. Screen carefully, applying the inclusion and exclusion criteria. with dual reviewers. PRISMA documentation is very important. This will help when you write the paper. Extract and appraise critically. Use standardized templates and bias assessment tools to ensure the quality of your included studies. And then synthesize clearly. Choose quantitative or qualitative synthesis based on the data comparability, highlight gaps, and interpret that meaningfully. So thank you very much for giving me this opportunity. And most importantly, we need to understand a good review does not summarize, it organizes, critiques, and clarifies. Thank you. With that, I shall take the question at the end of today's discussion. We are really waiting for Dr. Amit De, my friend's lecture now. So thank you very much.